from an employer's perspective, the most chronic condition in healthcare is the relentless escalation of healthcare costs. And if you look at this viewing point for the last 50 years, healthcare has been accelerating in terms of its cost, particularly to the employer, at 2 to 3 times general inflation. And as a consequence, it's been much less likely that an employer has been able to engage in raises in terms of wage raises, because the raises that employees are getting over the number of years is just expressed in increasing healthcare costs. Mark?
Yeah, so I mean, obviously, I think for 2023, healthcare costs are, I think, predicted to be around the sort of 6.5–7% range, which is actually a little less than general inflation. So this is a little bit of an abnormal year, and it's not 3 times general inflation at sort of 21% this time, but it's still going up, and this constant, increasing cost is not something that employers can always. There's always been some cost sharing going on, and there's been a slightly, that trend of sort of trying to push some of the costs onto employees, but that's getting more difficult for employers to do because of, there's a tight labor market, and sort of cost sharing only goes so far. But what's also done is come up with sort of different ways of doing benefit design. So, high deductible plans and things, because obviously a lot of people who are insured are effectively uninsured because they can't afford to actually use their insurance if they have them. So that's probably around about sort of 40% of the sort of working population probably would have a trouble sort of meeting their deductible under their plan. So we have this situation where we have, significant, escalation in costs, increasing in premiums. I think the premiums for a sick per employee is something like $14,000 to $15,000 per employee in 2023, and obviously range, which is unacceptable. And it's just this increasing cost that's sort of driving, for healthcare as well. So it's
Yeah, I would make 2 comments relative to what you said, Mark. Yeah, the reason, generally speaking, if you look over the last 50 years, it takes a while for the premium to react to hyperinflation periods. And so this accidental, relatively equal general inflation rate to the medical inflation rate is often because insurance companies have multi-year contracts with providers, and it takes a little while for there to be an expression of the hyperinflation into premiums. But most suspect that there'll be some significant jumps in healthcare costs in the next couple of years, and perhaps beyond the hyperinflation rates that we're seeing in general. So the bottom line here, though, is that there are 2 reasons why employers have escalating costs. One, most employers are trying to attend to, which is the unit cost per healthcare. And Mark, as you talked about, by changing benefit plans, by having a TPA or health plan work on their behalf to negotiate the best possible rates for the care that's being delivered by the provider world, there's an effort to try to control the unit cost for healthcare. What we're really talking about today is suggesting that employers have at least an equal focus on reducing the need for healthcare, reducing the number of units that are required to be administered to their workforce and covered lives. And if you can reduce the number of units and control the cost per unit, you can remarkably control this most chronic condition from the employer perspective.